and wanted to show you a couple things that we like to do with our mommy makeovers. First, we look at the tummy tuck. You can see she has a lot of excess skin and some spreading of the muscles. This is very common after pregnancy. The skin just didn't shrink all the way back. Sometimes it does, but a lot of times it doesn't. The muscles didn't come all the way back together. Sometimes they do. Most of the time they don't. But we want to add some refinement. So if you look at the post-op result, you can see a few things. First of all, we do an aggressive skin pull. You can see she's got a nice smooth skin now. I also like what's called a high lateral tension, and that means you can see it's a curved incision, and so that means on the outsides it actually pulls in, not only pulling down but pulling in. As I like to do a third row and fourth row of suturing on the outside like you would gather in a dress. So that's what pulls and cinches in her waist. See how she has a nice curved waistline now. I'm also obsessed with belly buttons. I like them to look great. I like a real innie. I like to hide the scars, and so we do a way we can do a suturing that does most of the suturing inside, and you can see she's got a nice refined belly button. It looks mostly vertical now. That will round out a little bit over time. But this is the refined tummy tuck that we like. The second part is the breasts. We like to do what are called the short scar techniques, and we use what's called a superior pedicle. You don't worry about the technical details, but the main thing is you can see her scars are short. She's got her implants are sized correctly. Now, once we have the diameters right, then the volume we can figure out with the patients. Some patients want a bigger volume, some don't. She wanted a nice natural result, which I think we've achieved here as well. With the implants in place, this breast lift should last 20 to 30 years. Also in her, you can see the thing that really helps, and that's common after breastfeeding. They lose fullness in the upper, what we call the upper pole of the breast. Now she has fullness again because of the implants. So it's a nice feminine look, nothing exaggerated, nice and natural, and you can see she has nice natural curves back. So this is our typical mommy makeover and what we like to do.